So hello and welcome. We are here with Zhao Jin. We are here in Chengdu, and we're gonna do a quick interview with him. He is a practitioner in Chinese medicine. He works every week, and he is also a teacher in Chengdu University. So welcome to this interview, and please introduce yourself briefly if you want to.
Hello, Xavier. Hello, everyone. I am, my name is Jing Fang. Okay, I'm a professor in Chengdu University of Traditional Chinese Medicine, and I worked for more than 20 years in the clinic. And my major, what I study is the different school of the Chinese medicine. And I also serve in the oncology department in the teaching hospital of the university. And I also work in the private clinic every week, weekly.
Yeah, for 5 days a week, 4 days.
4 days a week.
Yes, we're going to talk about this, about your clinic. We're going to talk about what you do in the university. We're going to talk about Chinese medicine, your studies, and everything. So stay tuned.
Okay.
So first question I wanted to ask you: do you come from a family of doctors?
Yes, actually, I'm the sixth generation.
Sixth generation.
Yes, sixth generation.
Okay.
And my ancestor, he actually was a very famous doctor in my hometown.
Yeah.
In Sichuan Pingwu, in that area.
Mm-hmm.
And he has a lot of patients, and he has a very good reputation.
Okay.
And also, the patient comes from maybe several hundred miles away from the area.
Wow.
Yeah.
Well, at least I know one patient you have that came from many thousand miles away.
Yeah,
Right?
but today is totally different because we have,
Yes, that's right.
more good, like the flights. We have a plane, we have
Yes.
the high speed train. But imagine that in
Wow.
this period,
Yeah,
the people will come walk to
like for months.
Like for months. Yes.
Wow, that's crazy.
Yeah, and sometimes they just use all of the money after when they arrive there, and my grandmother will not only just give them their the food,
Mm-hmm.
and then their and also sometimes we'll give them some money if they use all of the money, and then we'll give them money to go back.
Wow.
Yeah.
That would be months for them, right?
Yeah.
To go and just for a visit.
Yes.
Wow. So 6 generations this is a lineage,
Mhm.
right? That we say in Chinese medicine that you carry on your own family, right?
Oh, yes.
Okay. Well, okay. And also, I wanted to ask you, why did you decide to study Chinese medicine?
Yeah, that's a very interesting question, because at the beginning, I really didn't want to study Chinese medicine, because you will be stuck in the clinic table. I will sit here for really quite a long time. You see that. But at the beginning, my goal, what I want to do is actually the battlefield interpreter.
Oh, really?
Yes,
Oh,
like,
wow.
but when I graduated from high school, I saw a lot of the patients get cured by my father, and they were very happy, thinking, it's a good thing I need to do. Yeah, it's worth to do it.
Yeah.
So I changed my mind, and then I went to university to study Chinese medicine.
Wow. Oh, good story. And when you studied, I understand you have to study everything, I'm guessing, but did you take any specific specialization?
Yes, actually, during our undergraduate education, actually we study everything.
Yeah.
We received the comprehensive training in all core subjects, such not only in Chinese medicine but also Western medicine.
Yes.
Yes, and like internal medicine, and or surgery. When I was in internship, I actually did surgery.
You did surgery?
Yeah, I did surgery. I think it's a good thing I need to do. Yeah, it's worth to do it.
Yeah.
So I changed my mind, and then I went to university to study Chinese medicine.
Wow. Oh, good story. And when you studied, I understand you have to study everything, I'm guessing, but did you take any specific specialization?
Yes, actually, during our undergraduate education, actually we study everything.
Yeah.
We received the comprehensive training in all core subjects, such not only in Chinese medicine but also Western medicine.
Yes.
Yes, and like internal medicine and or surgery. When I was in internship, I actually did surgery.
You did surgery?
Yeah, I did surgery. I think it's a good thing. But I think I focus on Chinese medicine. I love that. And so when I was in a graduate school, I choose the different school of the Chinese medicine as my major.
Okay.
And and then after that, I get the doctorate degree. I went to Austin to teach Chinese medicine for 2 years.
In Texas.
In Texas, yes, in Texas. And then I went back, and then I taught. Actually, I taught acupuncture there, but I prefer herbs more. So now I primarily specialize on internal herbs therapy. So for an academic perspective, my research is centered on the theoretical study of the classic, the TCM test, encompassing all major traditions, including but not limited to the Shanghai Lun and the Golden Chamber and worm disease, but also some other famous doctor in history like Spring School and the Cold School and the Fire School, like that.
Okay. And when you were in the college, if you were you were doing surgeries also. For how many years did you study?
For the undergraduate student, I studied 6 years.
6 years.
6 years, and then I studied another 6 years for my doctorate degree.
12 years.
12 years, yeah, in total.
Wow. Okay. Yeah. Wow. And through the 12 years, what was the most important thing that you learned apart from Chinese medicine? Or what was the main idea that you realized?
So in 12 years, based on the education by my master, my advisor, and my father, and I realized that the traditional Chinese medicine requires systematic learning and must not to be confined to any single school or a master. No single school's scholarship can encompass all clinic problems. So that's why I also choose these different school of Chinese medicine as my major. Yeah, because I want to learn all of their thought, their academic thinking, and their clinic experience, and then I can use them to treat my patient, and I can treat them good, and I'm not just limited on one system. Yeah, one system or one thought.
Yes, that's really great, because normally people study Chinese medicine, chooses a scholar way or one master, and then go that way, and then many years after that they realize it's not enough. But it looks like you realize that on the first place, and I was thinking maybe that's also because you and your family already have a lot of experience, and I'm guessing you can talk about these things.
Fortunately, my father and my advisor insisted on the Bian Zheng, give the correct differentiation. All Chinese medicine treatment should be based on the differentiation.
Yes.
So after I studied different school of the Chinese medicine, I realized that actually they just try to tell us how we use the Chinese medicine's theory to give the correct differentiation to treat the different diseases.
Yes.
Or even sometimes the same symptoms, behind the same symptoms, underlying it, they have the different differentiation.
Yes.
So each doctor just try to do the research to explain that systematically, like Liu Ansu try to explain those symptoms comes from the fire. Like in Wang Haoguan and Zheng Qing'an try to, even the same symptoms comes from the yin syndrome or the yang qi deficiency, and the Li Dongyuan tried to tell us those symptoms could come from a qi deficiency. Yeah, that's very interesting. So I think that's the why I have these thoughts. And fortunately, I'm in China. So when we study, there's a very, very famous doctor who in Qing Dynasty. I think everyone knows that. It's who names Ye Tianshi, Ye Gui. Actually, he has 17 teachers. So he had 17 teachers, so 17, maybe 17 different thoughts, and so he studied, absorbed that, and then developed it as his thought, and then he became a very famous doctor in Qing Dynasty and created the worm disease system, right?
Yes.
Yes. So that's what I think in that moment. So that's also why I so address that the differentiation is so important.
Yes, it's like if this is Chinese medicine and you learn from one master, you learn to look at Chinese medicine from here.
Yes.
Okay. But if you have many masters, you look 3D, and then you have better understanding, right?
Yes. Actually, definitely. During my undergraduate student and graduate student period, actually I was interpreter in the clinic, so I have a lot of opportunity to follow a lot of the good doctor in teaching hospital. I translated for them, so I will observe. Actually, when I translate, I'm not just translate. I actually study as well. So I realize that everyone has their advantages that you need to study, and according to Chinese medicine basis, which doctor follow those principles more and will have better results from in the clinic. So that's why I also want to study the different school.
Yes. Yeah. Oh, I love this. So I had a question prepared here, talking about your master.
Yeah.
But I don't know if you have one master, because you say you have learned from so many. Do you consider someone to be your master, or there's various people? You have one master or more than one?
In my mind, I actually only have one master.
Okay.
Because in Chinese culture, the master is it's very important.
Yes.
We always say one day master, one day always father.
Yes.
Yeah. Okay. One day master, always father. So he has really good characteristics, and he is very charming. Yes. And he loved Chinese medicine so deeply, and he just pay all of the attention to Chinese medicine.
And you worked with him after you graduated in your doctorate period, or before?
Before.
College?
Actually, after I graduated from I did my bachelor degree.
Yes.
And so I just studied with him for my master degree and the doctorate degree.
Okay.
Yeah. Oh. He actually my advisor and my master.
And is he still alive?
Yeah, he's still alive. Yeah.
And he's still working?
He's still working.
Oh, great.
Yeah.
And you still have contact with him?
Yeah, actually, maybe this evening I will go to see him and talk with
really?
him later. Yeah, right after we finish the recording.
This master, what would you say he specializes on?
Oh yes, he actually also specialized on Chinese medicine and the classical study. And what I admired him is that he is the profound expertise in classical theory of traditional Chinese medicine, including like Huangdi Neijing, the Shanhan Lun and the Golden Chamber and worm disease and all of the school in history. Because what I told you before, he paid all of attention on it. And his daughter told us that he never see his father go out for playing or for the entertainment every day. In her memory, he just go his
everyday studying.
Just the reading and studying, like that. So many years.
Wow.
Yeah, and so his understanding is both deeply researched and insightful. He embodied a very traditional Chinese mindset, firmly believed that Chinese medicine must be practiced according to authentic Chinese medicine standard in diagnosis and treatment.
Okay, so this is your Laoshi, right? But you also studied several branches. So what would you say is your Chinese medicine right now? I know this is really hard to answer.
Yeah, when I heard that, so your Chinese medicine is a little bit strange because actually there's no who's Chinese medicine. Chinese medicine is Chinese medicine, right?
I know.
So actually, but my style, my practice of Chinese medicine actually is deeply rooted in the substance rather than form. By this, I mean that I adhere strictly to traditional Chinese medicine model of thinking, as well as its theoretical, diagnostical, and therapeutical standard in both teaching and clinical work. Even when treating diseases recognized by now we call Western medicine. I continue to follow the principle and the standards of Chinese medicine and have achieved excellent clinical results.
Yes, I have seen that. Yeah, we're going to talk about this later. And one last question before ending this blog is, what's your opinion on Chinese medicine today? Because your opinion.
Oh,
your opinion.
My opinion.
Your thoughts.
Okay.
Your thoughts on Chinese medicine today, and your thoughts on what could we generally do to try to improve it a little bit.
Okay. So for Chinese medicine itself, I think for more than 20 years teaching and then clinical practice, I think Chinese medicine now must practice leverage its strengths and adhere strictly to its own principles in diagnosis and treatment.
Yes.
It is essential to identify within the spectrum of the disease recognized by modern medicine the diseases and the disease stages, in which Chinese medicine demonstrated clear the advantages and clinical efficiency is a key basis on which Chinese medicines continually vitally depends.
Yes.
And now we need to find, in other words, we need to find what kind of disease or which stage of disease the Chinese medicine can treat. We need to find the board. In Chinese medicine, we cannot treat everything.
No.
We need to realize that. As well as with medicine.
Yeah.
So both of us have the advantages of each other. So we need to cooperate very well and treat the patient and then cure the disease, cure the patient and destroy the disease and make it last.
In Europe, we say this is a complementary medicine. Yes, I completely agree. Like Western medicine, we say Western medicine.
You don't say Western medicine, you say medicine.
Yes. It's great for some things. And Chinese medicine is great for some other things. So we have to use it together.
Yeah.
But then we as practitioners of Chinese medicine, for what you said, we really have to focus on diagnose on one side. And then, of course, we have to focus on what happens when a patient comes with a Western medicine diagnose. We have to realize that and understand that. But then we have to do our diagnosis. This is different, right?
Yes.
This is what you were saying.
Like what you said in my clinic, it's I think more than 80% patient bring their, the Western medicine diagnosis to come to see me. But what I do is just not forget it. Maybe it's just another reference. But when I treat them, when I diagnose them, I use my Chinese medicine's principle to diagnose it and to use this to treat them.
Yes. Yes. For instance, in my clinic, I have treated so many, constipations. But if I have a patient with constipation and I always use the same for constipation, that would not work because I have used like 20 different treatments for constipation. This is what you're saying. Yeah. To adapt Western medicine, but to keep the basics and principles of classical Chinese medicine, the core.
Yes, like you remember the last Thursday night when I had the clinic, the night shift in a teaching hospital.
Yes.
And one of the patients, actually, he is the kidney failure.
Yes.
Come to see me. And also, after he used some the pill that gets the kidney failure 3 years ago, and he gets the 2 years treatment by Chinese herbs, Chinese medicine, and now his CCR from the 170 down to normal 106.
Wow!
So we just turning back. Technically, it cannot be that, right?
Yes.
But we do that. But of course, that's firstly his body is healthy, except that one, and secondly, it's not for a really long time when he will visit me. Thirdly, we use the correct differentiation. I just use the Jing Fang modified to treat him for 3 years. Yes. And so I didn't think, that's a kidney failure, so that must be kidney deficiency, or that's a kidney failure with some nephropathy. So there should be a lot of fire. I need to clear away the fire, or or maybe there's too much toxin. So I get a lot of the moving blood herbs or some drainage herbs to discharge it. No, I just use the Chinese medicine's principle. Okay, the tongue is normal, but the coating is white and thin, and the pulse is floating. So it's the superficial evil. The evil just stuck in the superficial. Okay, in the wave fen. So I prescribe Jing Fang 5% modified. Sometimes I add a little bit ginseng inside, or sometimes with some Huoxiang, because here we have a lot of dampness. You can feel that. So and a good result is it's good. It's we have a good result. Even for myself, my phenomena after the COVID. I can show the test later. You'll see the imaging. It's all black, all white in my upper left of my lung.
Yes.
And also we only use Chinese medicine to cure that, and also my hypertension. After that, I get hypertension, and I also use Chinese medicine to bring it back to normal.
Yes.
So
that's great.
That's great.
It really works. I have not explained this, but I have been here in Chengdu for two weeks, and I have come here to attend your clinic and learn. And this week I caught a cold, a flu, we could say, and I tried your prescribed herbs, and I have to say it works amazing. It's really, really amazing. It's really different than what we use in Europe. It's the same, but it's
Yeah.
It's more perfected.